Hey everybody, Dr. R Fedich here, Clinic Director at Village Family Clinic. Talk to you kind of about two things today. We're going to talk about a little bit about tennis elbow and also about kinesio taping. So we see a lot of tennis elbow in the clinic. It's something that a lot of people suffer with really needlessly. So I'll give a quick explanation of that, and there's a couple options that we do for it. So real simple, if we move in our arm here, and here's Pat, our demo model, these extensor muscles, and we call it tennis because of the tennis stroke this way. When we use those muscles, the tendon inserts up here. And what I kind of tell people is every time you do this, it's like a little tap, tap, tap. And doing this repetitive motion, it gets some inflammation or swelling in there. So they're usually very easy to fix. Most of them, very few times you need cortisone shots, very random surgery. What we need to do is give this spot a little break. And we also need to get rid of the inflammation there. So typically we do ultrasound in that area. It works really well. Ultrasound or laser gets rid of the swelling. But even if you tried that or you've done a shot and it hasn't worked, the reason is because that spot keeps getting whacked 10,000 times a day every time you move your wrist. So what we want to do is we actually want to put the pressure a little bit lower. So you can buy a brace at the store. There's tennis elbow straps you can buy at the store. And what people wear those the wrong way, I'll see a lot of times, they wear it right over the area where it hurts. And you actually want to wear it about 2 inches below. And what you're doing is actually tapping this area for 10,000 times a day and getting this a chance to take a breath. So that's the point of those braces. You can also do kinesio tape for it. So I kind of want to do a two-pronged video. So this is kinesio tape. There's some inexpensive store you can buy at a sporting goods store, but these rolls are a few $100s of the good stuff. And it's actually not really tape, it's really cloth. So we take a piece of tape off. I'll take one demo piece and then we'll tape Pat. When we take a piece of tape off there, we'll see it has a lot of stretch to it, right? So if you take a regular piece of tape, it's not going to do that. So it's actually really a piece of cloth fibers with kind of a glue or an adhesive on the back. And it's the same thickness and kind of likeness to skin or material. So we can use, people kind of ask what the tape's for. We use it for a lot of different things. We use it to support different muscles. We can actually use it to inhibit motion. So we can tape it so the tape's pulling back and doesn't let you move a certain way. We can actually use tape for lymph drainage. There's all kinds of things. But for a tennis elbow, instead of a brace, we can use a piece of tape like this. We'll put it a couple inches below. And what we're going to do is take some of that slack out there. And that's what the art of this is. It's not just throwing a piece of tape on there. So we get it down. We're going to take a little slack so we get some pressure and wrap it around medium tight. We can also, so that'll be the main support. And sometimes with the tennis elbow, we'll do like a little drainage piece as well. So we'll cut this tape in a certain pattern. And this is why it's not just something that we do part-time or learn on a seminar. You really got to know what you're doing. And I'll do this a lot to help support these underlying mesh tissues underneath and get the blood flowing in there as well. So this is a little extra special pattern we'll do here. Didn't cut any pad off yet. This will just give a little further support. It makes him look a little bit like Spider-Man since it's almost Halloween there. So there's all sorts of different stuff you can do. Kinesio tape, but always a little bit of explanation about what tennis elbow is. This or the straps work really good. The tape will last, people always ask, depends on your skin, your oils, your bathing. 5 days, you know, on feet might last just a day or two. On something like this, it might last 5 to 7 days, depending on all sorts of stuff. It's a good way to give support, and it's mobile, and it stays with you when you're sleeping or driving and all that kind of stuff. And again, if you're having tennis elbow, come on down, give us a call. We treat a lot of tennis elbow. Conservative care works with chiropractic and ultrasound about 9 out of 10 times. So if you have a problem, give us a call at 813-8200.